I'm Dr. Joshua Gutman. I'm an associate professor of emergency medicine at Emory University and the founder and CEO of Petrie POCUS. Today, I want to talk about where ultrasound is going next. For the past 2 decades, point of care ultrasound has fundamentally changed how we practice medicine at the bedside. It gives clinicians the ability to visualize physiology and pathology in real time, make decisions faster than ever before. And we're now entering what I think is the next phase of that evolution. Artificial intelligence is beginning to merge with ultrasound in ways that could fundamentally change how images are acquired, interpreted, and integrated into clinical care. So today, I want to explore where AI and POCUS intersect, what already exists today, what's emerging, and what this could mean for the future of bedside ultrasound. As we go through the talk, I want you to think less about the individual technologies and more about the possibilities they create for how ultrasound might be practiced in the future. Here are my disclosures. I'm a consultant for some of the companies that I will be presenting. I will be mentioning some of these companies during the talk today, but it's purely for demonstration purposes and is not a formal endorsement. Before we talk about artificial intelligence and ultrasound, I want to zoom out for a moment. If you look at the history of medicine, every generation has had a diagnostic tool that has fundamentally changed how clinicians understand what's happening inside the human body. In the 1800s, it was the stethoscope. For the first time, physicians could actually hear physiology happening inside the chest. In the early 1900s, X-ray arrived, allowing clinicians to visualize anatomy without surgery. Then in the late 20th century, we saw the rise of CT scans and MRIs, which completely transformed emergency medicine and hospital diagnostics, providing more internal detail than ever before thought possible. Now, fast forward to the early 2000s and 2010s, and we saw another major shift, the emergence of point of care ultrasound. And for the first time, clinicians could bring imaging directly to the bedside and answer clinical questions immediately. And now we're entering what I believe to be the next major transition, the convergence of artificial intelligence and ultrasound. And the question we should be asking is not just what AI can do, but how it might change the way ultrasound is practiced altogether. The question isn't only how can AI and ultrasound be combined together, but how this will lead to an evolution of the way we traditionally think of bedside ultrasound and how it's practiced. So one of those major inflection points for our generation has been point of care ultrasound, and POCUS fundamentally changed the relationship between clinicians and imaging. Before POCUS, imaging largely lived in another part of the hospital. A clinician would order a study, a technician would acquire the images, and a radiologist would interpret them somewhere else. Eventually, the result would come back to the treating physician. Point of care ultrasound flipped that entire model. Now the clinician caring for the patient could bring imaging directly to the bedside. You can visualize physiology in real time. You can take what you found on your physical exam to the next level at the bedside. And you can answer focused clinical questions immediately. Is there pericardial fluid? Is there lung sliding? Is there free fluid in the abdomen? So instead of waiting for hours for imaging results, clinicians could often get those answers in seconds. And importantly, the clinician controlled the entire diagnostic process, from acquiring the image to interpreting it to applying it to patient care. It's not disjointed care, but the clinician acquiring and interpreting the images and correlating clinically in real time. And that was a massive shift in how imaging could be used in clinical medicine. Despite how powerful point of care ultrasound is, it has not grown as rapidly as it should have. When people predicted it would rapidly become as common as the stethoscope and would just take off. And if you look at the excitement around POCUS when handheld devices first appeared, many people predicted that ultrasound would rapidly become as common as the stethoscope. And as much as I would like to say that's true, that hasn't really happened. Even in emergency medicine, growth was slow and is only at the beginning in specialties outside of emergency medicine and critical care. But outside of those areas, POCUS is still far from universal. And what's interesting is that the barriers we're seeing today are not the technological barriers. Ultrasound machines are smaller than ever, they're cheaper than ever, and the image quality is really excellent. So the limitation isn't the hardware. The limitation is something else. So if the technology works so well, the obvious question becomes, why isn't POCUS everywhere? Why isn't every clinician using ultrasound the way we use a stethoscope? And why isn't it a standard bedside assessment across all specialties? And why are findings on POCUS still questions by specialists when done by generalists? The answer really comes down to three things: people, training, and workflow. And those are the real barriers, not the machine themselves. So the challenge with point of care ultrasound isn't whether it works. The evidence is there. The challenge is scaling it. POCUS is an incredibly powerful diagnostic tool, but becoming proficient with it takes time, and learning how to acquire good images require hands-on practice. It's not something you can learn just by reading a book or watching a lecture. At the same time, interpretation takes experience. Recognizing subtle findings on ultrasound, distinguishing normal from abnormal pathology or physiology comes with repetition and exposure. And then there's workflow. Even after acquiring and interpreting the images, those studies still need to be documented, stored, reviewed, and integrated into the clinical record. So although the technology itself has become easier and more portable, the human training component remains the major barrier. And that becomes the biggest challenge when we start thinking about scaling ultrasound across entire healthcare systems and regions around the world. To understand where AI might fit into ultrasound, it helps to think about how ultrasound has traditionally been performed, as I mentioned before. In the traditional model, imaging is a team-based process with clearly defined roles. A clinician orders the ultrasound study. The study is performed by an ultrasound technician or sonographer. This is someone who is extensively trained in image acquisition. Their entire job is focused on obtaining high-quality diagnostic images. They do this all day, every day. And those images are then sent to a radiologist or a cardiologist with echo who specializes in image interpretation. And these physicians have years of dedicated training specifically to interpreting imaging studies. And finally, the interpreted results are sent back to the treating clinician who applies that information to patient care. So this traditional model, expertise is divided. You have the sonographer, who's an expert in image acquisition, the radiologist is an expert in image interpretation, and the clinician is responsible for clinical decision-making. And this system works extremely well because every step of the process is performed by someone who specializes in that particular skill. Now, the reason the traditional ultrasound model works so well is because every person in that system is highly trained. Ultrasound technicians spend years learning how to acquire images, and that's their entire job. They obtain high-quality diagnostic images using expensive, sophisticated equipment. Radiologists and cardiologists spend years learning how to interpret imaging studies. In radiology training, a significant portion of that time is dedicated specifically to ultrasound interpretation. So you have experts in acquisition and you have experts in interpretation working together. This model has a limitation. It requires a relatively small number of highly trained specialists to provide imaging for a very large number of patients. That creates a bottleneck because the number of people who need imaging continues to grow. The reliance on imaging we have in medicine across the world is also continuing to grow. But the number of people with expertise to acquire and interpret ultrasound grows much more slowly. So even though ultrasound is an incredibly powerful tool, the traditional system cannot easily scale to meet the full demand of imaging. So point of care ultrasound created a new paradigm. Instead of separating acquisition and interpretation between multiple specialists, the clinician performs the entire process at the bedside. They acquire the images, they interpret them in real time, and they immediately apply the findings to patient care. And this was a major shift in how imaging could be used in clinical medicine. And for the first time, ultrasound became a bedside diagnostic tool controlled directly by the clinician. But the POCUS model has its own scaling challenges. In the current model, the clinician has to do everything. They have to learn how to acquire the images, they have to learn how to interpret those images, and they have to document and integrate those findings into the clinical workflow. And that requires training, practice, and ongoing experience. And while many clinicians learn ultrasound during courses or residency training, developing true proficiency takes time. And there are also a limited number of educators available to teach these skills. So even though POCUS dramatically expanded access to ultrasound, the model still relies heavily on individual expertise. And that means adoption grows more slowly than the technology itself. Historically, point of care ultrasound has largely followed what I would call a single operator model. One clinician performs a scan, interprets the images, and documents the findings. And that means the same person has to master image acquisition, interpretation, and workflow. And that requirement is one of the reasons POCUS can be difficult to scale. What we're beginning to see now is the emergence of a more distributed model. Instead of one clinician needing to perform every step, different members of the care team can participate in different parts of the ultrasound process. For example, a nurse or technician may acquire the images. Those images can then be interpreted by a clinician at the bedside, even by radiologists reviewing them remotely. And this is all the case because of artificial intelligence. The artificial intelligence helps bridge the gaps between these steps. AI can guide the image acquisition for less experienced users, including nurses and medical assistants. It can assist with interpretation and help automate documentation. So instead of a single expert doing everything, ultrasound becomes a system supported by multiple people and assisted by AI. And that shift has the potential to make ultrasound far more scalable across healthcare. If you can have people who are less trained and more available to perform these ultrasounds and assistance in both acquiring and interpreting those images, then you can get ultrasound out to way more people, and it can meet the demand in even the most rural and remote areas of the world. So what does this emerging model actually look like? So instead of one clinician needing to master both image acquisition and interpretation, artificial intelligence can begin assisting with both steps. From an acquisition standpoint, AI can guide the user while they're scanning. It can tell them how to adjust the probe, whether the view is adequate, and whether the image's quality is sufficient. In a sense, the system is helping teach the operator while the scanning is happening. From an interpretation standpoint, AI can also assist in interpretation by providing values such as ejection fraction and the presence of free fluid, either in real time or via post-processing software. It can also help highlight pathology that might be subtle on the screen. But it's important to emphasize something here is that the clinician is still making the decision. AI isn't replacing physicians, PAs, or NPs. It's assisting with tasks that traditionally require a very high level of technical expertise. And by doing that, it lowers the barrier for more people to participate in the imaging process. So once AI begins assisting with image acquisition, an important question follows. So who actually needs to perform the scan? Traditionally, ultrasound acquisition requires either a sonographer with specialized training or a clinician who has spent a significant time learning the POCUS technique. But if AI can guide probe position and help ensure adequate image quality, the pool of people capable of acquiring images expands dramatically. So now we can start thinking about nurses acquiring ultrasound images, paramedics in the pre-hospital settings, medical assistants and outpatient clinics, and technicians in rural hospitals, and even community health workers in global health settings. In other words, AI-guided acquisition has the potential to open ultrasound to an entirely new workforce. And when that happens, ultrasound begins to scale in ways that were previously very difficult. So if acquisition can expand beyond a single highly trained operator, the next question is interpretation. So who actually needs to interpret the images? In a traditional model, interpretation was primarily performed by radiologists or cardiologists. In the traditional POCUS model, interpretation happens directly at the bedside. Emergency physicians, intensivists, hospitalists, and other clinicians using ultrasound findings in clinical decision-making immediately at the bedside. And as ultrasound expands, interpretation can also occur across different levels of expertise. A bedside clinician may interpret a focus exam in real time, or a radiologist or cardiologist may review the images later or even in real time, or specialists may interpret studies within their particular domain, such as a urologist interpreting kidney studies with AI assistance. So what we begin to see is a more flexible system. Images can be acquired by one person and interpreted by another, sometimes immediately and sometimes asynchronously, and AI can assist at multiple points across that process, and it's still POCUS. So this leads to an important idea that I want the audience and you all to think about. When most of us hear the term point-of-care ultrasound, we usually picture a very specific model. A clinician at the bedside acquiring the images, interpreting them immediately, and applying those findings to patient care. That's what many of us were trained to think about POCUS. and how POCUS is defined for a long time. But as artificial intelligence begins assisting with both acquisition and interpretation, that definition may need to expand because now multiple people being involved in the may be involved in the imaging process. And even though the tasks are distributed, the imaging is still happening at the point of care and still informing bedside decision making. So rather than thinking of POCUS as a single person in every single step, we may need to start thinking about it as a system of care built around bedside ultrasound and care at the bedside. Many people can acquire, many people can interpret, and it can still be called POCUS. So why does this matter? It matters is because if ultrasound is going to reach its full potential, it has to scale. Right now, the biggest limitation to scaling POCUS isn't the machines, it's the training pipeline. We simply don't have enough educators to train every clinician to the level of expertise needed for both image acquisition and interpretation. And even when clinicians take courses or receive some training during residency or advanced practice provider programs, they often don't develop the confidence to apply ultrasound regularly in clinical practice. And without that confidence, ultrasound becomes something that people learn once but don't end up using. So if you want ultrasound to truly expand across medicine, we have to lower the barriers to learning and performing it. And that's where AI becomes incredibly important because AI can help guide image acquisition, it can help support interpretation, and it can give clinicians confidence that the images they're obtaining and the findings they're seeing are reliable. In other words, AI has the potential to reduce the operator dependency that has historically limited POCUS adoption. So when we think about artificial intelligence and ultrasound, it's helpful to simplify the problem. At its core, AI is trying to help with three things. First, helping users obtain the right image. For many people, learning ultrasound is the hardest part isn't the interpretation, it's simply getting the correct view, knowing where to place the probe, how to angle it, and how to optimize that image. And AI can assist with that in real time. Second, helping clinicians understand what they're seeing. Once an image is obtained, AI can identify structures, highlight potential findings, and provide measurements that help support interpretation. And third, helping the entire workflow move faster. Ultrasound studies still need to be documented, organized, reviewed, and stored, and AI can automate much of that process. So when you step back, AI in ultrasound isn't one single technology, it's a collection of tools that assist with acquisition, interpretation, and workflow. And those are the three areas where we're going to focus for the rest of the talk. So if we step back and simplify it, artificial intelligence is giving ultrasound three major capabilities that didn't previously exist at scale. The first is image acquisition. AI can guide the user while they're scanning, helping them position the probe, adjust the image, and determine whether the view they've obtained is adequate. The second is interpretation support. AI can analyze ultrasound images and identify patterns, measure structures, and highlight findings that might otherwise require significant expertise to recognize. And the third is workflow acceleration. AI can help organize images, generate reports, and assist with quality assurance, connecting the entire ultrasound workflow from acquisition to documentation. And I've been a little repetitive, but I'm trying to make that the point of how exactly AI can be helpful and scale. And so these things are what I want you to keep in mind. And for the rest of the talk, we're going to walk through examples of technologies that fall into each of these categories. And as you see these systems, I want you to think less about the individual product and more about the possibilities that they create. Because what's really interesting isn't any single technology, although those are certainly interesting. It's what happens when all of these capabilities start working together. So let's start with the first capability, image acquisition. So as stated, for many people, learning ultrasound acquisition is actually the hardest part. And you have to know where to place the probe and how to angle it and how to rotate it, how to adjust the depth and the gain, and how to recognize when you actually obtain a correct view. And this process takes practice. And traditionally, it requires an experienced instructor standing next to the learner, guiding their hand, helping them adjust the probe until the image is perfect. And what AI-guided acquisition systems are beginning to do is replicate that entire process digitally. As the user scans, the software analyzes images in real time and provides feedback. It can tell the user to move the probe slightly, tilt it, rotate it, or slide to another position. In essence, the system is teaching the operator while the scan is happening. That has enormous implications for training because now guidance doesn't have to come only from a human instructor. was limited and expensive, it could come from the machine itself. The following slides are going to be some video demonstrations on some technology. These videos either come from videos that I've made in the past on the Peachtree POCUS YouTube channel on these device reviews, and those are snippets of those, or they're coming from the product website themselves. So if you want to watch the full videos of any of these demonstrations, you can either go to the product website or you can check out the Peachtree POCUS YouTube page to get the full video. But let's start with the Equinos Cosmos with their cardiac image acquisition. The most developed space in AI in terms of image acquisition is cardiac ultrasound. And that makes sense because it's both very common and one of the most, probably the most difficult skill there is to image acquisition. And so let's walk through this video and I can show you exactly what it's doing. And so first, before we see, you can see this ability, you can see guidance, grading, labeling as something that can be done, and it's done with AI. So here I turn on guidance, and then if you look in that corner, it's telling the user to rotate the probe, to move the probe, and so the user can actually look at the ultrasound probe and decide and it tells them what they need to do to get the image. Turn this way, turn that way, slide up, slide down. So you can see that's what it's telling it to do, but also has these other things. So that's guidance. Then you have grading. So it'll tell you whether your image is good. So when those green bars get all the way to the bottom, that says, hey, your image is good, you can go ahead and save it. But when it's red, don't save. And the last thing you can do is labeling. And you can keep all of these on at a time with Equinos Cosmos, but here it tells you what you're looking at, the RV, septum, LV, et cetera, et cetera. So you can see with this product that it helps guide the user in what they're looking at by labeling and also how to turn the probe to get a perfect image and to tell them, hey, this is a great image. And this isn't the only one. The GE caption on the handheld GEs, the V-scans, can do this also. And so it's the same thing. It tells you what to do. It doesn't have it full rotating, but it tells you rotate it clockwise, and then it tells you how good that image is while you're doing it. So you can see this bar here. And then once you get a green image that's good, it'll automatically save it for you. So that's what the caption here is doing, is once you get a great image, then you hold, it'll record it, and so you don't even have to press any buttons, but it recognizes when the image is perfect. So here's another way that it helps with image acquisition. Those are two that are embedded into machines themselves. This is Ultrasight, which is a startup that does something similar, but this can be applied to if you do not have those specific machines that have integrated acquisition guidance. There are also existing software like Ultrasight, which can do this for you. And again, here it tells you how to move the probe, similar to the Equinos Cosmos. It gives you what a perfect image looks like. And then once you get your position, then it gets up to those green bars and tells you, hey, this is a great image. It'll save it for you. So very similar. And lastly, with cardiac, I want to talk about another company called Desky, which has a product called Heart Focus. And this is cool because it uses AI not to tell you what to do, move this way, move that way, but actually gamifies it. And if you look here, and this is a software platform that's worked into the Butterfly. So if you have a Butterfly ultrasound, you can use this software to help you with this image acquisition. It's not integrated into the Butterfly. It's a separate software subscription, but you can use it. Let me show you how it works. So you have this is your probe. This purple is where your probe is. And you can see that there's an arrow up here and across down here. This white arrow is the target position, and it looks the same. So when I'm going to start it, you'll see that the purple is going to start moving because that's where the user is. And the idea is you're going to play the game to try to get the purple arrow onto the white arrow. When you get the purple arrow onto the white arrow, then you're going to get your image. Voila. So that's really cool. If you don't like following instructions on the screen to telling you what to do, you can just follow it in real time. And then you can change it for each of the views that you're trying to look at. So it's telling you, hey, you're just going to turn it. This is a demonstration video. So it's saying, okay, turn this way. And once it's in there, then it'll turn green and say, hey, you've got a great image, and then auto save it just like before. And so that's pretty cool in that it gamifies the whole thing. It makes it super, super easy, even for people with very little experience, to be able to obtain the images. All right, moving on from cardiac, this is ThinkSono. They're a startup that has DVT image acquisition. So the idea here is it helps you obtain a full DVT point of care ultrasound by highlighting the arteries and veins. And so here the user is putting the probe on the thigh and it's telling you, okay, here's the vein in green, there are the arteries, and it's telling you what to do. It says compress for 10 seconds, and then the user compresses and you can see the green disappear, so you know it's good, and then releases. And then it'll walk you through the whole thing and end up saving it, that then can be used later for interpretation. And it lets you know, okay, this compression was good and you've gotten a good image. So not only do you have to do it, but it also makes sure your acquisition is correct. And then it can move on to the next spot and tells you how to go down. So it essentially with AI walks you through the entire DVT ultrasound and lets you know that you're doing it well and it's available for it. And then it could be available for either the clinician to interpret or being sent over to a radiologist. iSono is an AI-guided breast ultrasound. And this is pretty cool, is that this device here is just placed on the breast, and then it can then obtain the images on its own. Breast ultrasound is quite difficult. It takes specialized training, and there are specific breast radiologists who all they do is really read and do breasts. So in order to scale the use of breast ultrasound and to get into the hands of those that aren't as trained, that's what iSono does. In that once this thing is once it's put on the breast, it can obtain the entire image, the images of the breast itself with excellent acquisition, and then it can be sent to a radiologist for interpretation. So it really scales the ability for image acquisition. Here's something cool is, the next couple are robotic assisted ultrasounds. So you'll see in this one, this is a company called EndoCure, and their machine, essentially you attach the probe to it, you tell it where to scan, and it'll scan for you. So here that probe is put in to this robot machine, and then you pull it over. So don't need a lot of training for this, and you can tell it exactly where to scan. And so if you want to scan an abdomen, you scan an abdomen, and it highlights over the scanning area. And then afterwards, the transducer just goes on its own. And then with its methods, it then can acquire all these images. And so this is like taking the user completely out of it. Here's Robka, which is another startup that is made for ultrasound in arthritis, so joint ultrasound. And this is similar in that you have a machine that's doing all the ultrasound. The person just places his or her hand down, and the machine does the rest in terms of image acquisition. Let me show you, it's pretty cool. So this is someone going into an office. They put gel on their own fingers, or it's put by some sort of medical assistant. Then the machine comes through. You can see exactly where to go and look at each of the fingers. And so the person just stays still, and it goes on, and it can scan all those fingers and move all along it, which can then be interpreted. And the scan takes 5-10 minutes or so. But this can be done with basically no user at all. A person can just come in before having an appointment with a rheumatologist, for example, and get scanned completely. So here AI takes the image acquisition, they're completely out of it without any user at all, which is super scalable. So far, we've talked about how artificial intelligence can help users obtain images, but AI can also help improve the images themselves. And one of the realities of ultrasound is that image quality can vary significantly depending on the operator, the patient's body habitus, and the scanning conditions. Even experienced users can sometimes obtain images that are technically limited. We all know that. So what image enhancement algorithms are beginning to do is take those imperfect images and with AI, improve their interpretability. So AI can reduce noise, enhance structures, and clarify anatomical boundaries, but also find things on the screen that may be difficult to view with the naked eye. In some cases, images that might previously have been considered non-diagnostic become interpretable. In those situations, image enhancement doesn't replace good technique, but can help salvage images that would otherwise be difficult to interpret. And so here we have EndoCure, which I introduced before as the image acquisition, but it can also find the lesions, for example, if looking somewhere, and then enhance it to make it look a lot nicer. And it has an AI ability to enhance those images to make them much more interpretable. And on the right is a company called PONS. And what PONS does is it takes any ultrasound image and enhances it. And so these are examples of with contrast ultrasound, but whether you're using contrast or not, with just the B mode, you can't really see a lesion that's here, but then using their tools and their software, you could take any image acquired with any machine, run it through their software, and it enhances it to make it and makes it much, much more interpretable. So here is where ultrasound is being used to enhance the imaging. So it's kind of part of image acquisition to improve the quality of the images. So far, we've been talking about diagnostic imaging, but ultrasound isn't just a diagnostic tool. It's also one of the most important tools we use to guide procedures. And ultrasound helps clinicians place IVs and perform nerve blocks and drain fluid collections and guide needles safely into the body. And just like with image acquisition and interpretation, there's variability in how comfortable clinicians are performing these procedures under ultrasound guidance. So this is another area where artificial intelligence is beginning to play a role. AI systems can identify structures, highlight vessels or nerves, and help guide needle trajectories. So in some cases, which I'll show you, robotic systems are even being developed or have been developed to assist with the procedure itself. So ultrasound guidance for procedures is beginning to benefit from the same type of AI support that we're seeing in diagnostic imaging. So this is Mandera, which is a company that's created a device that uses AI to, once you identify the lesion, can point exactly where to go. So it tells you exactly how you get to where you want to get to. Here's another one. This is the Sonosite PIV Assist, how it helps in interpretation by differentiating the arteries and the veins. And so when you use the PIV Assist or peripheral IV Assist, then it tells you, hey, don't poke here, it's the artery, poke here, it's the vein. So that's really cool in enhancing safety. So far, we've been focusing on how artificial intelligence can help users obtain ultrasound images. But the next major capability is interpretation. And historically, interpreting ultrasound images required significant training and experience, recognizing subtle findings, distinguishing normal from abnormal physiology, and integrating those findings into clinical decision making takes time to develop. So this is where artificial intelligence can also assist. AI can measure structures automatically, highlight areas of interest, and help standardize how images are interpreted. And importantly, these tools are not designed to replace clinicians. Instead, they function more like a second set of eyes. They help confirm what the clinician is seeing, identify things that might otherwise be missed, and provide quantitative measurements that support interpretation. In other words, AI can help transform ultrasound interpretation from something that is highly subjective to something that is more consistent and repeatable. And there's so many of them. And so let's look at some of the initial ones. So this is ASAP, a company that has developed a tool that, using their cardiac point of care ultrasound algorithm, can then come up with AI assisted diagnoses for 11 or 12 kind of parameters here, including EF, valvular assessments, right ventricular assessments, and IVC. And so once you have the images and you run the AI, within seconds, it gives you results. And what's cool about it is it then tells you also what's normal and what's abnormal. So it helps with interpretation. And green means normal. So if something's highlighted green, hey, there's nothing really to worry about there. And this is a tool that's very sensitive. Yellow means it may be not so normal, and red is very abnormal. So it helps the clinician who's doing it not only interpret the scan with specific numbers like EF 50%, no MR, no aortic regurg, no aortic stenosis, but also assists with the interpretation by saying, if you're not sure what a normal aortic root is, and this aortic root is 3.2 centimeters, you could say, hey, this is green and that's normal. And this is built as a very sensitive tool to be able to do an echo read and provide values where you couldn't really do this in this way this quickly on point of care ultrasound. Here's the Echo Iris. Echo is a handheld ultrasound machine that within it has developed the ability to give you an ejection fraction. And what I don't show you is that they've also looking at heart failure with preserved ejection fraction. But let's look at the ejection fraction. So here you have a apical four-chamber view. So they changed the apical four-chamber view, and then what the AI does is first labels it, then you hold it, and then within 6 seconds or so, it gives you an ejection fraction. So that's pretty cool. Next, going into the lungs, this is Butterfly's beeline counter. And so a few of the handheld ultrasounds have these within it, but this will tell you how many beelines there are if you're wondering if there are three or more and if this is pathological. So once you press go, and it takes about 6 seconds, and it tells you a number of beelines. So here there's 0 beelines, and it uses AI to find those beelines. And then once you get those, they can save to the study. I wanted to briefly touch on Deep Breathe, which is another company that's developing lung ultrasound tools. Their tools aren't FDA cleared yet, but they have a lot of cool things, looking for pleural effusions, looking for pneumothorax, using AI. And then I think they're developing some pneumonia tools also. And so they're focused on lung interpretation of point of care ultrasound. So as soon as their products get off the ground, AI will be able to be used to look at pretty much all aspects of lung ultrasound and automate it. Next, looking at Butterfly's bladder volume, and there are other products that have this too, but this is using AI effectively as a bladder scanner. And once you go over the bladder, and you see the bladder there in that image, and then you can use the automated volume. It automatically looks for the bladder, highlights it so you know that it's actually encompassing the entire bladder, and then you press calculate, and it scans it and gives you a volume, which is super nice because otherwise you have to sit there and do all the measurements, which is not hard or takes a while, but if you can automate this and do this even quicker, all the better to get you a full number. And then there's so many others in development that I don't have videos for, including breast, COPD, peritoneal hemorrhage from trauma, fetus gestational age and fetal presentation, more lung, carotid artery for blood pressure estimation, and more. This is just the beginning. The third area that I'll briefly touch on where artificial intelligence has the potential to transform ultrasound is workflow. And one of the most time-consuming parts of performing ultrasound today isn't actually acquiring or interpreting the images, it's documenting them. Images need to be labeled, organized, and incorporated into the medical record. A report has to be written, the findings have to be communicated and archived. And in many settings, this still happens manually. But this is an area where artificial intelligence could dramatically streamline the process. If AI can recognize structures, identify findings, and understand what type of exam is being performed, it could potentially generate a structured report automatically. The clinician performs a scan, the images are captured and organized, the relevant measurements are extracted, and a draft report is generated. The physician can then look over the report and the ultrasound, make sure it's saying what it needs to say, and sign it. Now, to be clear, most of this capability is still emerging and not widely implemented yet, but from a technical standpoint, the pieces are starting to exist and isn't that hard. When you combine automated reporting with AI-assisted acquisition and interpretation, ultrasound begins to move from a manual workflow to a much more integrated system and make folks much more likely to actually document their exams. In December of this past year, Butterfly released its AI version of the POCUS Manager or middleware software called Compass AI. It has two specific AI features for their workflow, which are really cool. One, it will automatically classify images by image quality using ACEP, or the American College of Emergency Physicians, 1 to 5 rating scale. So what this does is twofold. For people doing ultrasound QA, they do not have to sift through poor image quality clips in order to do the QA. They could just focus on the ones that are better quality. When learners do scanning, they often save several poor quality clips, and it takes a fair amount of time to work through these. Anyone doing QA is probably nodding their head. So in this way, the QA reviewer can just review the clips that are the best quality. And a part of QA is actually grading the images according to that same scale. So Butterfly AI will do it for you. So what this does is it's both standardizing the grading system across multiple QA reviewers. What I think is a 4, someone else might think is a 3, which someone else might think is a 5, for example. So it'll standardize it and also cuts down on the QA time. And the other thing that Compass AI does is assist with documentation. So what Compass AI can do is if you simply tell it the results, then it will create a report based on those. So for example, if you say, fast exam negative, it'll create a report or a billable report that shows the fast exam negative. You don't need to log in, click through a negative report. You can just do it with your voice, and it makes billing compliance easier. Or you can say the fast was positive in the right upper quadrant, or the cardiac ultrasound was negative other than a pericardial effusion, and it'll do it for you. So far, I've shown you these capabilities as separate buckets: acquisition, guidance, interpretation, and support image enhancement and workflow automation. But the real transformation isn't one of these pieces on its own. It's what happened when they start working together. Because when you combine acquisition AI, you reduce the barrier to getting diagnostic quality images. More people can scan and the images are more consistent. When you add image enhancement, even imperfect images become more interpretable, which matters in the real world, where patients move and conditions aren't ideal and operators are at different skill levels. And when you layer in interpretation AI, pattern recognition and measurements become more standardized, and clinicians can focus on decision making rather than struggling with uncertainty. When you connect all that to the workflow automation, the whole process becomes smoother. Images are organized, documentation is easier, and quality assurance becomes scalable. So instead of ultrasound being a skill that only scales as fast as we can train individual experts, it becomes a system that scales across teams, across sites, across healthcare settings, across the world. And that's the bigger picture, is when these pieces come together, ultrasound becomes dramatically more scalable. So let's take a step back and imagine what this might look like in practice. Imagine an emergency medicine intern on their very first day of residency. They've done some fast exams during medical school, but they're not confident. They walk into the trauma bay, they can pick up an ultrasound and begin scanning a patient. And historically, this is a moment where many learners feel uncertain. Am I holding the probe correctly? Is this the right view? Am I missing something? There may or may not be a faculty member present for the scan, and the intern may not feel comfortable asking for help as much as they should. Now imagine that same scenario with AI assistants. As the intern scans, the system provides real-time guidance, helping them position the probe and obtain correct views. Once the image appears, the system helps identify the structures on the screen and confirms that the view is adequate. Suddenly, the learner isn't guessing anymore. They're getting immediate feedback, and that changes the learning process dramatically. Instead of needing months of trial and error before feeling confident and getting reamed at during QA, learners can start acquiring useful images much earlier in their training. Now imagine a different setting, a small rural clinic in any part of the world that you imagine. In many parts of the world, and even in many parts of the United States, access to diagnostic imaging is limited. There may not be a radiologist on site. There may not even be a trained sonographer available. But the clinic has a portable ultrasound device. A nurse caring for the patient performs the scan. AI helps guide the acquisition in real time, ensuring the images are adequate. And those images can either be reviewed by a clinician locally, or if the local clinician is not trained, transmitted to a specialist somewhere else, anywhere in the world for interpretation. In this scenario, ultrasound becomes accessible in places where traditional imaging infrastructure simply doesn't exist. And that's one of the most exciting possibilities of combining AI with portable ultrasound. It allows imaging to extend far beyond large hospitals and into settings that historically haven't had access to these diagnostic tools. Now I'll take that idea one step further. Imagine ultrasound becomes as common as the stethoscope, not limited to specialists, not limited to hospitals with dedicated imaging departments, but available wherever patients are being cared for, in emergency departments, in primary clinics, in ambulances, rural health centers, and global health settings. Ultrasound device, as ultrasound devices have become smaller and more affordable, the technology itself is no longer the factor. What has limited its expansion has been expertise required to use it effectively. That's exactly the barrier artificial intelligence has the potential to lower. If AI can guide acquisition, assist interpretation, and streamline the workflow, ultrasound becomes much easier to integrate into everyday clinical practice. And when that happens, ultrasound stops being like a niche skill. It starts becoming a fundamental tool used across medicine. Now we're entering the next phase of that evolution. Artificial intelligence is beginning to assist with acquisition, interpretation, and workflow. And as that happens, ultrasound becomes easier to learn, easier to perform, easier to integrate into everyday clinical practice. The result is that ultrasound can expand far beyond the traditional imaging model, not replacing clinicians, but empowering them, helping more clinicians answer clinical questions quickly and directly at the bedside. It allows for more physicians, NPs, PAs, medics, etc., to use ultrasound confidently in real clinical environments. So why is this all happening now? Because ultrasound is reaching an inflection point. Over the last decade, three major trends have been happening at the same time. First, ultrasound devices have become dramatically smaller, cheaper, and more portable. What once required a large machine in the imaging department can now fit into your pocket and is on your phone. Second, computing power has increased dramatically, allowing artificial intelligence models to analyze images in real time. And third, we now have massive amounts of ultrasound data available to train these systems. When those three forces come together, portable hardware, powerful AI algorithms, and large data sets, they create a moment where the technology can suddenly accelerate. And that's where we are right now with ultrasound. For decades, ultrasound has been incredibly powerful, but difficult to scale. Artificial intelligence may be the tool that finally allows it to scale across medicine. And if every generation gets one leap forward in medicine, this may be ours. Before I end, I just wanted to bring attention. If you or anyone you know is looking for an ultrasound course, I'm doing an ultrasound course at the end of August 27, 28 here in Atlanta, Georgia, called the Petrie POCUS Kickstart Live. Our course that was scheduled for May was completely sold out and the waitlist started growing. So we just opened another date in August. So there's still plenty of spots available, but they're going to go fast. We already have several registrants for that. And so if you want to come learn from Petrie POCUS, from myself, from all the great instructors and have a 2-day intense hands-on course, make sure to check out petriepocus.com/kickstart. If you just remember petriepocus.com, the pop-up will take you directly there. So thank you again for your attention. If you'd like access to the references that inform this talk, you can scan the QR code here. And if you're interested in continuing the conversation about point-of-care ultrasound, artificial intelligence, or POCUS program development, please feel free to reach out. My contact information and social channels are here on the slide. Thanks again for being here today, and I'm happy now to take any questions or comments. No, as I went through the talk, it is enhancing and empowering and making everyone better. It's bringing the confidence that if you're looking at an ultrasound and you're not sure where you're supposed to go and what you're supposed to do, you can then use AI to help build that confidence. You can say, I think this heart has very poor contractility. And the AI, like in the ASAP that I showed you, will say, this is very poor contractility. So it helps empower, but it doesn't replace. You still need a human to look over and make sure the results are good. I have seen times where, let's take the bladder scanner, for example, where the AI won't incorporate the entire bladder. And so it takes a human to say, look at it and say, it actually hasn't gone over the entire bladder. I have to do this again. And so the more you start using AI, and I use a fair amount of AI, including ultrasound in practice, the more you realize that it's super powerful. And over the next years, it'll get better and better and better. It still takes someone, a human, to look it over who is trained, but it just brings down those barriers to training. It brings up the confidence. And so it makes people better. Now, the good question is, will there be skill degradation? And this is something that is a larger question for AI, is are we going to get worse at ultrasound because we're just going to depend on AI for everything? That would be a good question. And I don't know the answer to that, and it's possible. But think about it this way, and this is, I heard from a podcast by Bob Wachter, who is at a UCSF, and he said people don't really know how to use maps anymore because there's GPS on their phones. So there's map skill degradation, and my kids certainly don't know how to use a map, and I doubt your kids and anyone here do also, so who cares? And so it's an interesting idea to think about, but I think ultimately humans are going to be in charge because that's what people expect. Different platforms have different prices. So you can imagine the big robots are expensive. But the idea is that from a clinic standpoint, if you get one of those robots, for example, and put it in your office, and you may pay $50,000, $100,000 for that robot. I'm making up this price, but I do not know how much any of these things cost, those big robots. But if you have, and then you can perform an ultrasound and then bill it in-house, you can end up making that money back and making more. So there is that element of cost. Some of them are software. So the Heart Focus is software. The Butterfly AI within it is an elevated subscription. So some of the AI is featured within it itself. The Echonos Cosmos, for example, doesn't cost any extra. You buy the probe, you get the AI along with it. And some of the other ones, like the Heart Focus or Ultrasight, are additional software subscriptions that they use post-processing. So basically that image is overlaid onto their software. And then from there, you can use it to guide your acquisition. So it really depends.
Jennifer says, these are fascinating examples of AI POCUS. I can see how this would change the trajectory of diagnostic imaging. Thank you for presenting this. A few questions. How receptive are clinicians feeling currently to using AI POCUS? Where are we on the curve of adaptation to AI? And how are healthcare systems receiving new AI technology considering cost implications? So it's three questions. Let me know if you want me to repeat any of them,
Yeah,
Dr.
it is rapidly becoming integrated. Even in my own health system, I could see within the last 6 months that we have more AI than we ever did, and everyone's talking about it. I think it's like any new technology, there's always a curve. You have your 5%, 5 to 10% early adopters who like jump on it, and I consider myself one of those. And then you have your kind of 60, 70% kind of with the curve, and then you have your last 20% are late adopters. And so that's where we are now with AI, is you have some health systems. Mayo Clinic, for example, has gone all in. I mean, they do a ton of AI development. They readily give out their images to AI companies in order for them to use it to develop platforms. And then you have other systems that will not give out any images at all. And so you have those late adopters or early adopters, and that's throughout all the health systems. So where we are in the curve is still early, but it's rapidly growing. If you could ask the tech companies, it's already way farther ahead. I think clinicians, especially ones who are more into the early adopter, are starting to be okay with it. And they're skeptical, as you should be. And I think it's also specialty dependent. There's some specialties who tend to be more, I'll count emergency medicine in that, and to be more hopping on all the new technologies. And then you have specialties like pediatrics that always are late adopters to technologies. It's a broad answer, but because there's so much variability right now. But one thing is for certain, it is going to be growing fast. And if I were to give this talk 1 year from now, it would be probably the technology would be very different than what I would give today, and we would be speaking very differently. So that kind of what I touched on. The interpretation always, you need good images in order for good interpretation, and bad images make bad interpretation, but AI will helps with the acquisition. So if you have AI, for example, for interpretation, but not for acquisition, you're not going to, the AI is not going to be able to interpret a bad image. On the ASAP platform that I talked about for cardiac, which I have a fair amount of experience with. In that one, if I'm not getting good images for whatever reason, because the patient just has poor windows or has other factors, then the AI won't be able to interpret. The AI has to interpret something that's interpretable, and that it basically reads to its data set that it already has. And where the AI can help with the image acquisition, can help break down that barrier.
All right. So for our two questions, to integrate POCUS into the standard of care for non-radiologists, should we push for a legal reclassification of ultrasound as a functional extension of the physical exam rather than a formal imaging study?
Radiologists are now understanding the role of POCUS, and hospitals are understanding the role and especially with ultrasounds that radiologists are not doing. Radiologists are not doing lung ultrasound. Radiologists are not doing fast exams. Radiologists aren't even doing musculoskeletal ultrasound exams, especially in real time in acute care. And so if you reclassify it as a physical exam, you lose any of the reimbursement and the investment in the program, right? You have to buy these machines. And if you want to recoup the cost of the machines by billing for the studies, this is something that a lot of this has been solved in many, not 100%, but a lot of these turf wars have been solved in this way. Some are easier and some are more difficult. There's no perfect, they're all good for different reasons. So they all have their pros and cons. And so if you want to learn about all the different devices, I have a ton of device reviews on the Petri POCUS YouTube page. So if you just go to YouTube, put in Petri POCUS or youtube.com/@PetriPOCUS, there's a ton of device reviews where I go through pros and cons of most of the machines out there. What I would say, if you're going to buy a machine, go with one of the established brands, especially some of those that I've reviewed, because there's a lot of devices that you'll find on sort of Facebook ads, and they're just poor knockoffs and not worth spending the money on. If you're interested in buying, I do consults related to handheld ultrasound. If you go to petripocus.com/handheld, you can see some information and I can help you decide on which system is right for you, which is great because if you're going to be spending thousands of dollars on a handheld, having some expert help is worth a few dollars investment.